We are live, ma'am.
So, hello friends, welcome to the NEET Recall 2024. Okay, so for the students जिनका पेपर अच्छा गया, I am really very happy for you. And for the students जिनका पेपर अच्छा नहीं गया, it's okay. Paper was like that. It was the whole paper was like ki there are two twins and how will you differentiate them? Okay, so I know the questions, they were very tricky, but I know one thing, that the topics, the questions, the topics was around the topics which we had discussed in the class or in your in GT. Okay. So as I always start from all my live session from the odontogenic cyst. So there were three questions back to back from odontogenic cyst. Okay. So the first question. So patient had a trauma 8 years back, and after 8 years, the patient had pain. Okay. On aspiration, there was 1 or 2 drops of blood, and it shows the cholesterol cleft. So one very striking feature, which was histopathological feature, which was given, that there was a presence of cholesterol cleft. I do not say that cholesterol cleft is not seen in dentigeresis, but I have mentioned in all my session, if you have to choose between the dentigeresis and radicular cyst, so you have to choose radicular cyst. Now, some students, they have marked this question as traumatic cyst. Now, first of all, traumatic cyst, it is a pseudocyst, and it is most commonly seen in the mandibular posterior region. So this option was out. This option was out, and the answer was, it was a very direct question. It was a radicular cyst. So what happens? The patient sometimes they get trauma. The tooth becomes non-vital, and the lesion keeps on increasing in the size, and ultimately the patient comes with the pain. And when we test that, when we do EPT or cold test, it comes as a non-vital tooth. It comes as a non-vital tooth, and since the lesion, it is very long standing, so that is why it first, as you know, that sequelae of the pulpitis, first it will go to periapical granuloma, and then it will go to the radicular cyst. So the answer for this question is radicular cyst. Now see, this is the histopath of the cholesterol cleft. So when we aspirate, what do we get? Cholesterol crystals. Now these cholesterol crystals, they give shimmering effect, and when we see it on the slide, we see cholesterol clefts. So these cholesterol clefts, they are surrounded by multinucleated giant cells. Now what is this? This is arcading pattern. So this arcading pattern, it is seen in radicular cyst, along with, we also see in inflammatory collateral cyst. Inflammatory collateral cyst. So if in your question, if they would have mentioned radicular and inflammatory collateral cyst, then also the answer would have gone to radicular cyst, because that's how we prefer all the options. Now the next question was on Dentigerous. 19-year-old patient presented with a painful impacted tooth with an inflamed follicle of size 1.5 to 2 mm. Now see, this is a very tricky question. Some students, they have marked dentigerous because even this 1.5 to 2 mm, it is considered as a normal follicle. But in our live session, we have discussed dentigerous occurs when this follicle size, it is more than 5 mm, then it is considered as dentigerous. So the most appropriate answer for this question is enlarged follicle. But if they would have given this as a normal follicle, it would have been more appropriate. But since we have 4 options and we have to choose one, that's how we have to go about it. Okay, so the answer was dentigerous, where follicles, now in dentigerous, the follicle size is more than 5 mm. Here the answer is enlarged follicle. Now, third question, glandular odontogenic cyst. Now this I have recalled this in your final lab in TND because I had this huge gut feeling that this question would be asked in your paper. Okay, so similar histopathological feature was discussed in the live session. Now, how we will rule out the option? The first is it is present in the anterior mandible. Okay, histopathology reveals this image. Now, ameloblastoma, it is most commonly seen in mandibular posterior region. Same with the OKC and radicular cyst. Chalo, some students, they have marked it as radicular cyst. But can you see any Rushton bodies here? Can you see any Rushton bodies? No. So the answer is very direct. It is a glandular odontogenic cyst. Now, what is glandular odontogenic cyst? So as the name suggests, there are gland-like feature which is present. So see, there is a presence of goblet cells in the glandular odontogenic cyst. See, this is goblet cells. Now, these goblet cells, they are filled with the serous or the mucinous area. It is totally filled with the serous or the mucus. Along with this, we see hobnail appearance in the glandular odontogenic cyst. So, most common site, it is mandibular premolar or the canine, which says that it is most commonly seen towards the anterior. Radiographically, it is seen as multilocular radiolucency. Now, coming to the OKC, see, OKC was also there in your option. OKC में क्या देखते हैं? 6 to 10 layer thick lining along with corrugated surface with presence of picket fence appearance, or which is called as row of tombstone appearance. So this is tall columnar cells in which the nucleus is present at the same level. This is called as picket fence appearance or the row of tombstone appearance. So the answer was glandular odontogenic cyst, which is also called as, because it behaves like a salivary gland, that is why it is also called as cysto-odontogenic cyst, and because there is a presence of mucus cells, it is also called as mucoepidermoid odontogenic cyst. Now see, this was the chart which I shared, I think 2 days back, that the most important topics which you have to revise, okay, 1 day before exam. Now see, this is the classification, and this classification which we will be doing in our live session and which I have been doing for many years. See, all the questions were asked from this topic, that is radicular cyst, dentigerous cyst, glandular odontogenic cyst. And I can totally say that in your next paper, again, the topics will be from here. Mark my word. The topic will be from here. Okay, nothing will be asked apart from this. Now, next is tumor. Okay, so the first tumor which we study in the live class is ameloblastoma. So island and cords of epithelium in dense connective tissue stroma. So some students, they were confused between desmoplastic ameloblastoma. Desmoplastic. Now, desmoplastic ameloblastoma, there is a fibrous connective tissue. There is extensive fibrosis occurring in the connective tissue. That is why it is called as desmoplastic ameloblastoma. But they have just mentioned dense connective tissue with islands and cords of epithelium. So the answer directly goes to plexiform ameloblastoma. So there are 6 histopathological features of ameloblastoma. See, now we will discuss this. What is ameloblastoma? So the basic structure of ameloblastoma remains the same. That is, what is the basic structure? There is a peripheral tall columnar cells, and in center we have stellate reticulum like cells. So this is your 6 histopathological ameloblastoma. Now what happens whenever there is a metaplasia occurs in this stellate reticulum like cells, it will give rise to different forms of ameloblastoma like acanthomatous, granular, and the basal cell ameloblastoma. So acanthomatous mein what do we see? We see keratin production because of presence of squamous cells. Granular may we see many lysosomes. These lysosomes, they fuse together and result in the most aggressive form of the ameloblastoma. Most aggressive. Okay, basal, these are just the primitive cells are seen. Okay, cuboidal basaloid morphology. So these are called as basal cell ameloblastoma. Now this is plexiform ameloblastoma. So odontogenic epithelium arranged in the cords forming interconnecting network. So the answer was very direct. It was plexiform ameloblastoma. Now see, desmoplastic. What happens? There is extensive fibrosis occurring in the connective tissue. Because of extensive fibrosis, the epithelium is very compressed. Epithelium is very compressed, and that is why it is called as kite or bird shaped. See, this is the kite or bird shaped epithelium which is present. Now, the next question was from salivary gland. So, cyst, 3 question. Tumor, 1 question. Salivary gland, 1 question. Okay. So, these 3 topics, this is the sequence where when we study in the live class. I always start with odontogenic cyst, then I go to the tumor and then salivary gland. So, this was also a quite easy question. A 60-year-old man with a diffuse parotid swelling. So the questions are easy because your faculties, they have made it easy for you because they have given out exact proper notes. When you go through it again and again, so these questions, they become easy. So those who have studied, for them it is easy. So 60-year-old man with a diffuse parotid swelling since last 20 years, which was asymptomatic. So there was a parotid swelling, okay, which was present and the patient was completely asymptomatic. Now there is a numbness and tender in the parotid. So numbness is because of the involvement of the facial nerve. So what is the diagnosis? Very direct, it is a long-standing malignancy. So generally what happens, which is the most common tumor of the salivary gland? It is pleomorphic adenoma. So if this pleomorphic adenoma, so I have discussed it becomes very long standing, then it can convert into carcinoma x pleomorphic adenoma. X pleomorphic adenoma. Just give me a second. Question number 2 again. Okay, I'll discuss that. Not a problem. Okay, so 19-year-old patient presented with a painful impacted tooth. So which is the most common cyst associated with the impacted tooth? We know that it is dentigerous. Now we know that dentigerous, it occurs because of the fluid accumulation which is present around the tooth, okay, reduced enamel epithelium. So when this follicular space, it increases more than 5 mm, then it is called as dentigerous. But here the follicular size they have mentioned is 1.5 to 2 mm. So we cannot say that it as a dentigerous. We can just say it as a normal follicle space, okay. But since the option was enlarged follicle, so we have to go with enlarged follicle. For ameloblastoma was given as present in small island of cells. Okay, even if it is said that small island of cells, 1 second, small islands of cell, but if there is a presence of cords of epithelium, cords of epithelium, then the answer would have gone to plexiform. If there is a presence of extensive fibrosis in the connective tissue, then the answer is desmoplastic ameloblastoma. But this is what I have got from many students in recall. Okay, so based on that, the answer should be plexiform ameloblastoma. Okay, so this was also discussed in your classes. Blue sclera, fracture bone are pathogenomic of disease having deficiency of which type of collagen? So it is type 1 collagen. Okay, that is osteogenesis imperfecta, type 1 collagen. Now osteogenesis imperfecta, it is also called as BBD, that is brittle bone disease, Lobstein's disease. Now this because of bone is very brittle, it is also called as chalk stick fracture. So chalk stick fracture, it is also seen in Paget's disease. Okay, there is an abnormal type 1 collagen production, and what is the gene mutation? It is COL1A1. Remember, it is COL1A1 A2, but the collagen 1 is affected, not the collagen 2. Okay, but A1 A2 is there. Okay, but here they have not mentioned A1 A2 or anything like that. Just type 1 collagen. So this was a very quite easy question. Now, 3 patients have oral lesion. Which of them has maximum chances to convert into malignancy? Okay, unscrapable white lesion. So it is generally leukoplakia. Red velvety lesion, they are telling it as erythroplakia. Erythroplakia. And mix of both the types, all of the equal chances. So we know that erythroplakia has 17%, just erythroplakia. So in your Schaefer's, it is clearly written erythroplakia has 17% higher chances to convert into malignancy than your any other lesions. Okay, so the answer here goes to the red velvety lesion. So these are typically associated with erythroplakia, which I have already discussed. Incidence of the malignant changes is 17 times higher in erythroplakia than the leukoplakia. Fibroblast. So this was also a very easy question. Fibroblast produce collagen with the help of which vitamin? So vitamin C. Okay, so the answer is vitamin C. Now this was a very tricky question, and it totally depends upon the examiner, because many of the articles says this, some of the articles says that, but still, okay, we will follow Schaefer's and we will mark accordingly. So 80% of metastasizing soft tissue cancers to the oral cavity. Okay, so we know that 80% of the metastasizing soft tissue cancers in the oral cavity, it is present in jaws. Okay, that is mandibular, but jaw was not there in the option. Jaw was not there in the option. So the next better option goes to the tongue. So it is written that tongue shows higher tendency to metastasize to any other parts of the body, and it shows lymphatic spread. So if we can correlate with that, I would say that the best option goes with the tongue. But I know that most common malignant site, most common malignant site in oral cavity is equally shared between the buccal mucosa and the tongue, and somewhat it is said that in India, buccal mucosa is more than the tongue. Most common site is goes metastasized in the oral cavity. Okay, that is the buccal mucosa. But here they have twisted the question. 80% of metastasizing soft tissue cancers to oral cavity, it is, I would go with the tongue as the best option. Now, metal ingestion, sweet smell and grayish line in the oral mucosa. So this is a direct question that it is seen in plumbism. So plumbism occurs as a result of lead poisoning. So here the answer is B. Okay. So what do we see? What is that line called as? It is called as Burton's line, and it is a common symptom of lead poisoning. Hi Jyoti, good evening. It was enlarged follicle. Yes, the answer was enlarged follicle. But still, when we consider it histopathologically, the diagnosis of 1.5 to 2 mm, it is considered as normal follicle. Okay. Now, ये तो देख के ही पता चल रहा है, as we have discussed this many time. ठीक है. What is this? Okay, cherub face. Okay, so the answer, we don't even have to see the question. There is a presence of bilateral swelling in which there is eyelid looking upward, that is eye turned heaven appearance. Okay, eye to heaven appearance. So the answer here is cherubism. How was the paper, guys? Pranav, Jyoti, you can mention in the comment box. Okay, so what is cherubism? It is also called as familial fibrous dysplasia of the jawbone. Now, what do we see? There is a multilocular radiolucency or the expansion of the jawbone because of the increased osteoclast, and then there is an increased formation of the bone. Now, see, the main clinical feature here, what you have to see is there. It is also called as floating tooth syndrome or floating teeth appearance. Now, as we know that there is an extensive alveolar bone destruction. So the tooth which is present, it looks like it is floating. That is why it is called as floating tooth syndrome appearance or early exfoliation syndrome because of alveolar bone destruction. And the child, they look like a plum-cheeked angel, cherub's eye to heaven appearance or full moon face. Okay. Now, what is common between McQueen-Albright, Fanconi and Noonan syndrome? So we know that McQueen-Albright में हम क्या देखते हैं? Cafe Eulard spot. I don't know what was the C and D. I would be glad if you guys tell me what is the C and D. But I got these two options because students, they were like, ma'am, it was very easy to rule out C and D. So we were confused between these two. So I think the best option would go with Cafe Eulard spot, as it is seen in all the three: McQueen, Fanconi and Noonan syndrome. Now, identify the pathology in the radiograph. Okay. So this is also a very direct question. Now, what do we see? Radio opaque mass. So this is a radio opaque mass which is seen in the posterior part of the jaw, and it does not resemble tooth-like structure. So in the question, it was mentioned that there is a radio opaque structure which is present in the posterior part of the tooth which does not resemble tooth-like structure. So the answer is odontome. Which is the most common odontogenic tumor in the oral cavity? It is odontome. Again, okay, so two questions from tumor. Most common odontogenic tumor. So compound, complex. So we have learned this complex region is always complex. Okay, so complex odontome, it is most commonly seen in the posterior. Compound, it is most commonly seen in anterior. So in posterior, it is seen as irregular radio opaque mass. Now, the next question, very direct: area of the biopsy of the ulcer. So we never take the biopsy from the center of the ulcer. We never take. We always take from the border of the ulcer so that the adjacent normal tissue also comes in that. Okay. So we always take it from the border of the ulcer. Okay. So image based question was there, and this I have discussed and this I have given many times. Ki see this topic Pemphigus lichen planus, it has been asked many times continuously from past 3 years. They are asking Pemphigus in all your exams like your INI and NEET. Okay, so this was a very predictable and very easy question. They have given that there is a fishnet appearance. So when we see on the immunofluorescence, the characteristic fishnet appearance is seen in which condition? It is seen in pemphigus. But they also have mentioned there is a denudation of epithelium near the lesion on the slight touch. They had also given there is a antibodies which is present against IgG, which goes to the answer pemphigus vulgaris. So this was the recall of oral pathology, and I would say that all the questions were from the notes. So this, whenever I start any my session like live session or the recorded session, you would see this. I always start with this most important topics which you have to cover, and see the direct questions have been asked from most important topics like radicular cyst. So if I tell there were 3 questions from cyst, 2 questions from tumor, 1 question from salivary gland. So even if you have attended these first 3 sessions of mine, you would have solved out of 15 question or out of 14 question, you would have solved 6 questions direct, straightforward, very direct question. Okay. So if anybody wants to take, ma'am, in the question it was mentioned. Extending to CJ. Which question? Would you please tell me which question, Ankita? They have mentioned radiolucent swelling extending till CJ. If they have said the word CEJ, then it should go to the Dentigerous. But I'll be glad if you will tell me. Yes, Jyoti, I know it was a balanced paper, but the options were slightly tricky, and it was not just respect to one subject. All the subjects, I would say that the options were slightly tricky. Okay. So, if anybody wants to take the screenshot of this, take this, put it on your wall and stick to this. Okay. And I can say that your questions will be asked from all this important topic. Okay. Skin pathology, lichen planus, pemphigus, pemphigoid, systemic lupus erythematosus, ectodermal dysplasia. Bone pathology, see, cherubism is there as one of the important topic. Fibrous dysplasia, pages, along with few of the infectious disease and along with the syndromes and biopsy. Okay, there was a one question from biopsy also. Okay, so this marks the end of today's session. And for the juniors, so this recall was most importantly, it was for the juniors, because this will tell you how you have to prepare. You don't have to go for the hi-fi questions. Just trust your faculty, just trust the Bhatia, and we have everything that is required in your exam. So in the Advanced Plus plan, you will get all the live lectures, you will get recorded, you will get the clinical videos. If you want to see the recorded, you have all the recorded videos of each subject in detail wise, which is required in your exam. Okay, nothing more, nothing less, with a lot of test series, clinical videos, and you will also get the hard copy of the notes. Okay, and also you have daily mentorship by Dr. Himani ma'am, okay, which will keep you on the track. Okay, so I wish you all bestest of the luck, and you just have to stick to your notes and give lots and lots of solve lots and lots of the question. That is suffice, that is actually required for your preparation. Nothing more, nothing less. Okay, chalo, bye bye, all the best.